Okay, for my second bonus five, I'm going to be talking about the clinical application of the C-section. I found this very interesting because it was, when we talked about it during our lecture, it was a lot of stuff that I didn't personally know about. So C-section is just a surgical removal of the baby. Is not really known as the natural way. It is actual surgery. Reasons for this is if a baby is breached, so if they're trying to come out feet first, if they have certain health conditions, if the cord is wrapped around their neck, or if the placenta is trying to come out before the baby. And in other times, well, it's also because once you have one C-section, you will forever have C-sections, and that's what doctors tell moms in today's time. For the reasons why C-sections, also because it's a preference for the doctor, because it's more convenient for them. And I thought that was very interesting during our lecture when you were talking about it, because it's more convenient for the doctor, and it's more of with natural birth, you don't know when the baby's come, around the time, an estimate. With C-section, it's scheduled. And sometimes some moms, they request a C-section. Now, C-sections are very much more riskier than normal birth, which is a vaginal birth. More riskier for the mom and the baby, not just for one than the other. More risk for the mom because of infections, the mom getting sick with anesthesia, the mom getting blood clots, increased risk for blood clots and injury, because when the C-section happens and the doctor is cutting the stomach and the uterus. So, and then the risk for the baby is a risk for increased risk for being cut, and sometimes breathing problems, and a lot of other problems could occur. And sometimes, being that it's not a natural birth, it's really a high risk of the baby being delivered very, very much earlier than what they are supposed to. And another thing about C-sections that I read up on, and that we discussed a little bit during class, was C-sections are what we talked about in class was C-sections were done more now because of an economic and financial standpoint, not for us as people, but as for the economy and the government. And that's how they make their money, because C-sections, I read, can be about almost $15,000, and a normal birth is only about $5,000 to $7,000. So those are two completely different number ranges when it comes to money. And of course the government, the economy will keep doing good because of stuff like that. Because if everybody was having natural birth, yes, that's a lot of money, but it wouldn't profit as much, of course. Excuse me. And C-sections are not, C-sections are, I read that now in today's time, C-sections are more, I want to say, pushed on the patients because of the doctors and not because of the patients, because the doctors tell, oh, this is better or this is easier and faster. They don't tell them this is because of economic reasons, because it's more convenient for themselves, but they're trying to make it seem as more of a good thing. And this is why a lot of people, like you stated during our lectures, this is why a lot of people do midwives, because midwives help, they know the process, and they help the patients, being that a lot of people are first-time mothers, of course. Even people that just don't know that they do have other options. Then the midwives tell their patients what the doctors won't tell them. So that's why a lot of people go with midwives, because the midwives will speak up for the patients, and they will educate them on what is really, they don't really have a bias. They're there for the patient. They will tell them what it is and what it's not. So that's my video on clinical applications about the C-sections, about their the process, the what it is, the risk, and before I end it, recovery time could be about a month or longer. So it said 6 weeks to 6 to 10 weeks or 6 to 8 weeks, and a full recovery time for mom. And if nothing happens from baby, if like anything that's not premature or anything else, then that will be normal recovery time for baby. It's not really a recovery time, but for mom, because it is surgery and incision is made, takes quite longer than a more normal birth, vaginal birth. So that's my clinical applications.